So this is going to be the wound irrigation and dressing change. I've already reviewed the patient's medical record and identified the correct procedure that I'm supposed to be doing. I performed my hand hygiene and put on any PPE, so put on my gloves. No PPE is required for this one. So I identified the patient. He stated his name and his birthday for me. I have all of my equipment on the table. It's within reach. I have a trash can also within reach to discard all of my stuff. The curtains are closed. There is adequate privacy. And I also assessed for any pain, so I gave the pain medication and waited the adequate time to do this. So the bed is adjusted to the comfortable height for myself. I'm going to expose the wound, only the wound. Alright, and I already placed the kidney basin off to the side of the wound, so when I irrigate, the drainage will drain into this. I would originally place like a chuck or an absorbent pad on both sides of the abdomen, but we don't have those, so we'll make do. Okay, so I checked for any IV placage, any drains that are in place to make sure everything is clear to do the dressing change, and I also took any personal belongings and put them off to the side. So we are all set. So I have my gloves on, and I'm going to check, I'm going to carefully remove the old dressing by using the push-pull method. So basically you push on the skin and you pull the tape off. And it's a little different on a mannequin, but whatever. So push, pull, push, pull, push, pull, push, pull, push, pull.
Probably because normally we have these hooked up to mannequins.
Push, pull, push, pull, push, pull, push, pull. And I would discard this, but first I would look at any presence of drainage, and I would look at the amount, type, color, and odor of the drainage. So this one has none.
Because you're going to hook this one up, right?
And then I'm going to take out the packing, and this also has no drainage on it, so that's good. I would dispose of this as well. And then I'm going to assess the wound itself, so I would look for the appearance of it in general. I would look at the stage, the presence of eschar, any tunneling, undermining, granulization tissue, any epithelialization, necrosis, and then also I'm going to measure the wound itself. So on my cotton swab packagey stuff, there's in centimeters, so I'm going to measure it from top to bottom. So it's 13.4. Then I measure the thickest portion of the wound, so about 2.7, and then I'm going to open it and take the cotton swab, and I'm going to stick it in the deepest part of the wound, measure it up with the tips of my fingers, and then measure that appropriately. So it's about 2.3. Then I would discard of this. So I'm going to remove my disposable gloves and set up my sterile field, also performing hand hygiene. Okay. So I checked everything, nothing is expired, nothing was open or damaged in any way, and everything was dry. So we're good to use all of this. So take your drape, open it away from you, grab it by the corners, open it away from me, and make sure to set it up, not reaching over it. So anything hanging off the table is contaminated, and the outer 1 inch is also contaminated. So I would open everything that needs to be on the sterile field 6 inches above. So discard of that. The abdominal pad, so open it away 6 inches. And then I have my gauze, so I'm going to be placing this one, maybe emptying it onto the sterile field, but saving the container.
This is going to, I swear, this is going to be, look at all this fluid.
So that I place that there, I cannot put anything underneath where that is, because now that area is contaminated. And then open my saline bottle. And the inside of the cap is sterile, so I'm going to place that on my sterile field as well. And nothing can go underneath that cap as well, since that's the outside is contaminated. Open another gauze. This one, I'm going to keep the gauze in here.
Yes, it is.
Open away from me. And then open the irrigation tray also away from me. I'm going to trade. And then I'm going to pour the sterile saline into each of the gauze packages. So, pouring.
Hold on.
And then
Make sure
pouring. And then place again. And I'm going to put on my sterile gloves, so I'll use the bed. So open away.
okay.
Discard of the packaging. Make sure the cuff end is towards you. Maybe. Here we go. Okay, so with your non-dominant hand, you take the inside of the glove with your thumb and forefinger. Place it carefully on your dominant hand, making sure you're not touching the outside. Then with the 3 fingers of your gloved, sterile hand, place it inside of the cuff, non-dominant hand, and now you can adjust the cuffs. Right. Anyways. Oh, I just broke sterility. I would not do that. Anyways, right. Anyways, so lift this up, making sure not to break sterile field like I just did. Fill the syringe up with sterile saline. And then irrigate the wound, so I can touch the skin with this hand as long as I don't use it again, because it will be contaminated. So I angle it, and then I irrigate the wound up and down, making sure the drainage is coming out. And then this is contaminated, so I have to keep this away from the sterile field. I'd fill it up again and irrigate one more time, making sure the drainage is coming off clear. Alright, so I'll put this back in. I would dry the wound. Pat gently and discard of this. I just broke sterile field again. It's fine. And then I would take my contaminated hand, put any type of like topical ointment or gel in this, my sterile hand, and apply to the inside of the wound and the outside. And then at this point I would take my sterile gloves off, perform hand hygiene, and re-sterilize or put on new sterile gloves. So then we're gonna change the dressing. Pretend I already did that. Okay, so you take your wet gauze and fold it. I would drain any excess solution out and fold it like an accordion. Then I take my cotton swab and pack it. And this is where the pain medication comes into play, because this is painful for most patients. Okay, so I discarded this, keep my hands sterile. Place dry gauze. And then my abdominal pad, blue side up. And at this point, the sterile dressing is complete, so I can take my sterile gloves off and tape the dressing and discard of my gloves appropriately.
Where's your tape?
And then when you're doing the taping of the dressing, you have to make sure the tapes overlap each other, like so. I'm not going to do this side because there's nothing to tape to, so. Okay, and then you would clean up, reposition the patient as needed, and